Hi guys, it's Shoshana RNY and Penelope, my doggy. As you know, my dogs always make an appearance. It is May 24th, 2017. It is my week, I'm looking at notes around my dog. My week 24, so I didn't come to you for like a week and a half because I didn't come to you like on my regular day. Let me start with my stats. So my highest weight was 300.2. Day of surgery, I was 287.2. Last time I came to you, I was week 22. I was 217.8. And this week, week 24, I am 212.6. So this week I lost 3 pounds between week 23 and 24. I should look up what I was week 23. Sorry. Give me a second. So week 23, I was 215.6. So I lost 2.2 pounds the week before. And so since the last time I came in to you, I lost 5.2 pounds. The difference for my highest weight, I've lost so far 87.6 pounds. And since surgery day, I've lost 74.6 pounds. So I want to say thank you to all my subscribers, my YouTube fam, my Insta fam. Down below is where you can contact me on all social media outlets. So Instagram, I think my Snapchat's on there. I don't really snap, not really. I feel old. Facebook, my email, Fitbit. We could be Fitbit fams. I'm starting to get gray hair. Do you see that? Do you see that? One hair, it's gray. It's gray. Gray hair. So I'm 28 years old. I had gastric bypass here in Toronto, Ontario, Canada at Humber River Regional Hospital on November 30th, 2016. I'm going out of order with Dr. Laz Klein. There you go. There's my stats. I haven't done this in a while, so I feel weird doing it. Yuckies in your eyes. So do you want more in the video? Here she goes. Here we go. Now we're both in the video. Yeah, I love you too. Sorry, I'm distracted. So what's been happening in the last? Now she's not in the video. She's just gonna block my face for the whole video. So in the last, I just had my 6-month video visit yesterday, actually. So they are super pleased with me. If you're my friends on Instagram, you know that I've lost now 74% of my excess body weight. So my clinic is actually really happy with me. They said if I didn't lose another pound, they would be happy. They were happy with my results. But of course, I want to lose more. What else did they say? So I saw the nurse practitioner. I saw the nurse, the social worker, and the dietitian. I first saw the social worker, which she actually runs the support group I go to once a month, so it was fine. Like, I was comfortable talking to her. I asked to see the psychologist that works with my bariatric clinic, just because I am struggling emotionally with things. I'm having some real issues with my body and just coming to terms with what's going on. I'm having some issues within my family related to health. I have a lot of resentment built up from childhood and stuff, and I have a lot of trust issues. So a lot of it stems from my mother and she's separated from her husband, so a lot of it stems from them. I guess my weight growing up and just a lot of things. Growing up in an emotionally abusive house and seeing it, and I just really don't trust other people. I don't trust men. I eventually would like to I've been thinking about dating. I don't even know how to go about it because I just don't trust people. I don't trust that guys are genuine. And it's not like people, like, I haven't been approached ever. I have. I've gone on dates. I just don't feel like people are genuine. So that's some of I should just do a whole video on dating and things like that eventually. I then went to, so she's, unfortunately, because there's only one psychologist, his waiting list is really long. So through my family doctor, I've been assigned a social worker to meet with. I met her. I don't really like her. I thought I'd give her another chance. The social worker with the pediatric clinic said, if you're not clicking the first time, ask to be switched. The social worker that I met with and from my family practice, family doctor, didn't kind of understand that like I really need to heal like from my past. So I don't know. We'll see. I'm going into so then I went to see my nurse and I've had some issues. I have my cell phone out because I'm going to talk to you about the issues I brought up. So I brought up, so they think maybe my medication, my antidepressant anxiety medication might need to be adjusted because of the malabsorption. So I might not be absorbing all my medication. So I have an appointment to go to my family doctor in 2-3 weeks. So that can be adjusted to see what we can do. I also talked about the bloating I talked about last time. So after I eat, usually it's not even just carbs, anything. I get like really, really bloated. So boy, do I know what bloating is now, because before I did not know this. I know what bloating, and it looks like I'm pregnant. And I feel really constricted in my pants, and like it's just really uncomfortable. So they told me to call my surgeon and talk to him. They also think maybe because I've been constipated and things, that could be it. The other issue is I've been having pain on my side. I've only gone it 4 times in the last 3 months, so I've been having pain on my right side. So they want to make sure my gallbladder is okay. Sorry if I'm talking fast. That's usually how I am when I have lots of information. I talk fast. I'm a fast talker. So they want to make sure I don't have gallstones. So it's my surgeon that would do that. So I have an appointment with him in 2 weeks. So I called and got into him in 2 weeks. So I'm going to see him in 2 weeks. I talked to them. I've been getting dizzy spells, so I could just be standing and I'll get dizzy. I'll be sitting and get up and get dizzy, lying down, get up, get dizzy. Today I was, I don't know if you, again, saw Instagram. I took a picture of me sitting on the floor, my legs crossed, which before would be so uncomfortable because I was sitting with my student in his quiet area. He was having a bad day, and I was just sitting there for like pretty much the whole morning with him on the floor. Only thing was my butt was cold. And so when I had to keep getting up, I was getting dizzy. So we talked about that. So they were saying to just increase my water maybe, because they're happy with how much water and how much liquid I actually get in, but she's saying increase my water. If that doesn't work, increase my salt intake. And if that really doesn't work, then talk to my family doctor and see. There's not much I can do with low, because my blood pressure is low. It is on the lower end. So there's not much that they can do about low blood pressure. So with all that information, I went to go then see the dietitian, which I wasn't too pleased about with her, because the dietitian I saw, it's a different dietitian. The dietitian I saw before, she's on maternity leave, and I like another they have like 3. And this one I didn't even click with before surgery. So she thinks my eating time, I need to adjust my eating times, which the other dietitians don't think. I never said anything about adjusting my eating times, because I eat at like 6:30, then I eat again at 10, then 11:15. I can't, like at work I can't adjust my eating times because I get set breaks. Then I eat again at 11:15, then I eat at 4, then I eat at like 7:30, and then I usually can't eat after that. Like I'm so full by the time the evening comes. And then my mom brought up how I'm not hungry to eat dinner because I am so full from the day of like eating and drinking that I don't want to eat much. Then she was bringing about how I need to eat carbs at every meal, and I find that I can't. Like I don't. It's not that right here. I'm gonna pull it. I need to get my protein in. B, the starchy carbs, like the pasta, not the pasta, I haven't tried pasta, the bread, the potatoes don't sit well, so I can't do those. And I'm full. And I find, and that was another thing I was going to tell you guys, that when I do increase my carbs, so like the last couple, I want to say last week, 2 weeks, I've increased carbs and like kind of been snacking on crackers and stuff, I'm not losing as much. So I was just saying, yeah, and just, I'm going to do what I've been doing because it's been successful. And I have what I want, but it's not like I'm deprived or anything, but I just need to do it. So she was just saying I need to add a fruit to dinner, or I can add a fruit to breakfast, but I can't, like, and I'm not a morning eater, so having a shake in the morning is fine. She was telling me because I need to eat a quarter of a cup of carbs before bed. Are you kidding me? I can't even, like, I'm so full by that time. I can't. No. And then she was just telling me that I need to add inulin, fiber, which didn't do anything before. And then because I have pooping issues, I always have pooping issues, so I either have diarrhea or I have constipation. I've been taking Ducalax, which is a laxative, like almost every day, and so she was just telling me to switch to Senocot S, which sometimes gives me tummy pains, and then milk of magnesia, which I don't want to take because it's gross. So, yeah. So they're pretty much happy with me and my progress. Am I happy with my progress? It's slowed down, and some of it is my fault for snacking more. My face looks really fat in this video. That's been what I've been thinking about the whole time. I would like to, my anniversary date is the 30th. I would like to get down to 90 pounds lost by that time. I originally wanted 100, but I know that's not possible. I don't see it really. I'm definitely in like an extra large top now, which I find weird because I don't know. I just find it weird because like I'm like a size 16 pants, I think. I don't know, I haven't tried on pants in a while. I've been getting slowly rid of some of my clothes that are too big. I don't know, I just don't see it. Like I know I'm smaller, like I know I'm smaller than what I was because I looked at some pictures. And my face is smaller, but I just don't, and I just don't see it overall. I just see like a stomach that sticks out and like the rolls, and yeah. So I'm having a difficult time with that too. As you, wrinkles, my face on my skin. Yeah, there we go. It's been a long day. The skin on my face is really dry, I've noticed. I used to have like really nice skin. There's the phone. Always want to make a video. Hi, I'm gonna call you back. Bye. It was my mother, so I can talk to her that way. Yeah, other than that, I think that's about it. Again, thank you all for who's been tuning in and kind of wondering where I've been and encouraging me to make I'm sorry. Like, oh, what's going on? See, look how bad my skin is. What? Oh my god, I need to stop. So thank you for like tuning in and encouraging me and kind of wondering where I've been and messaging me. I really do appreciate it. And I do look at your photos, and I am watching videos slowly again on YouTube. And I'm always on Instagram checking like Insta story. I do do a few Insta stories on Instagram, and I'm watching your Insta stories and I'm liking your pictures. So yeah, I feel this video was rushed, but I was just trying to get all the information and try to remember. Yeah, this week should be a quiet week. I just want to get back on my food, on point on food. I've been really thinking about exercise and what I want to really get into. Yeah. And then next Wednesday, I have my meeting at the hospital, and then I have my Tim Hortons meeting the Thursday, so I'm meeting with quite a few people, and yeah. All right. So, take care, have a good week, and hopefully next week I'll be like 90 pounds down, and then I'll be closer to Wonderland. All right, guys, take care. Bye.